Hi, today in one of our videos we're going to go over how do you find a competent cosmetic plastic surgeon in this social media driven world. Well, there are many ways to still find that surgeon that works for you, but here's some basics. First, you want to make sure they're board certified. And there are many different board certifications for surgeons who do cosmetic surgery, but the primary plastic surgery organization, the American Board of Plastic Surgery, is the only organization that certifies plastic surgeons who've done a plastic surgery residency. So American Board of Plastic Surgery, and see if that surgeon is certified by them. There can be otolaryngologists who do facial cosmetic surgery that are just as qualified, so you may see one of them. Otherwise, there's really no filter. Any physician can self-designate themselves a cosmetic surgeon. Just be aware of that. It doesn't mean that they would not necessarily do an okay job in certain cases, but the training is different. So American Board of Plastic Surgery. Second, the social media persona that you see may not always match the competence or the education of the doctor. We used to say the best ad sometimes wins. Well, with social media, the best social media presence may portray a physician in one way when the skills and the results are another. So you have to be very cautious finding a surgeon just with social media. Certainly many excellent surgeons have very good social media presence, but you need to temper that with other checks and balances. Finally, one of the most important things is when you meet the surgeon and you talk to the surgeon, and hopefully you do. If you go to a surgeon's office and you meet with one of their staff or their nurses and you never really see the doctor but for a few minutes, I think that's a clue that you might want to think twice. I have colleagues who would disagree, but I think the surgeon that's going to operate on you should be visiting with you and really getting to know you, and you need to get to know them. That's probably really where the rubber hits the road. When you meet that surgeon after you've already done your due diligence, how's that connection? Because if that connection's not there, you need to use your instinct and think about it. There's some other clues. Is the surgeon going to do your entire surgery? Or is there anybody else involved doing your surgery? Ask that question. Get that response directly from the surgeon, not from his nurse. Then you really have to look them in the eye and just see if you have that trust factor. And if they have a genuine interest in you, you will recognize it. Those are the basics right there. I hope that helps you when you seek a plastic surgeon in this current environment.